Hi, everybody, and welcome to episode 49 of the Pet Behavior Chat. So today we're going to chat about abnormal repetitive behaviors in dogs. And it's going to be a great episode. I'm going to kind of give you an overview of what we know and what those presentations are. I think they're going to be pretty relevant to both pet caregivers and vets as well. And the first thing I want to do is just start off by giving us a bit of an overview of the terminology. So I've called this episode Abnormal Repetitive Behaviours, and this is definitely a terminology that we are using more and more. So these behaviours are also called compulsive behaviours. Some veterinary behaviourists will call them obsessive compulsive behaviours. Perhaps another category of that would be stereotypical behaviours, although that's slightly different. But there's no consensus, as in so many things in the veterinary behavior world, there's no consensus on what exactly we're going to call them. But abnormal repetitive behaviors, I think, sort of covers what we see clinically, and also, potentially what the causes of some of these behaviors might be. So I just want to quickly touch on the terminology of obsessive compulsive disorders. And we have definitely split camps here. So we have some veterinary behaviorists that say, yes, obsessive compulsive disorders is an appropriate terminology. And then we have other veterinary behaviorists that say, no, we can't say obsessive because we don't know whether our pets have that obsessive component. So in human psychiatry, OCD, everyone's heard of OCD. OCD is a definite diagnosis, but we can ask people about whether they're obsessing about something, whether they have those sort of intrusive thoughts of having to perform certain behaviors, and whether that becomes almost an obsession. And we simply don't know that in our pets. So yeah, there's a lot of controversy about what we should actually call these behaviors, but I think abnormal repetitive behaviors is probably a safe place to be. So that's what we're going to call them. So I'm going to give you a bit of an overview today of what those behaviors are, how we kind of subcategorize them, and then also a little bit about what happens in the brain, or what we think happens in the brain, and then a little bit about how we actually go about treating these behaviors. And abnormal repetitive behaviors are interesting in that we've got a lot of research on them. And the reason that we have a lot of research on them is that canine models of some abnormal repetitive behaviors are thought to be models for human OCD. So there's been a lot of research into the canine behaviors to see what we can extrapolate for the human sector. And probably the most common behavior that's looked at in that particular way in dogs certainly is acral-lick dermatitis, and I'll chat a little bit more about that in a second. We also have other species that do repetitive behaviors, such as guinea pigs, mice, rodents, all the sort of laboratory animals. We have a lot of them doing what we call barbering, which is plucking out their hair or pulling out hair either on themselves or on conspecifics. And that's been looked at as a model for trichotillomania in people. So there's a lot of crossover, and there's a lot of sort of research potential, I guess, between both dogs, other laboratory species, and some of these human OCD conditions. So there's a lot of research there, and I will chat about relevant papers. But what I really want to focus on is sort of the clinical presentation and what we see in our pet animals, because that's what I mainly deal with, and how we can diagnose, treat, try and understand what's going on there. So when we think about classifying these behaviors, we can probably classify them into 5 sort of big groups. One would be your locomotor abnormal behaviors, abnormal repetitive behaviors. And there we would see things like spinning and tail chasing and pacing. So anything that's locomotor, where the dog is actually, sort of doing motor movements that are repetitive. The second big group would be oral abnormal repetitive behaviors. So that's anything that's kind of orally focused. So we're thinking about flank sucking in Dobermans. We're thinking about They also blanket suck. We're thinking about things like acrylic dermatitis. We're thinking about excessive licking of surfaces. We're thinking about anything, a repetitive nose licking, for example, anything that's sort of an oral behavior that's abnormal and repetitive. The third big group would be what we call hallucinogenic or neurological, maybe even visual behaviors. So those are your border collies that maybe shadow chase or stare at shadows or lights on walls. We also have fly snapping in there. So dogs that kind of snap at the air as if there are flies there, but there aren't. So those are more your sort of neurologically driven and that sort of hallucinogenic type. So that's the third category. The fourth category would be repetitive vocalization. So that would be dogs that repetitively, stereotypically bark or vocalize. So that's the fourth category. And then finally, the fifth category would be self-directed, self-harm, self-aggressive, self-injurious behaviors. And that can be, linked to some of the other behaviors. So that could, for example, be tail chasing, but then with trauma to the tail. Acrylic dermatitis certainly also falls into that category. I actually have a patient who has an abnormal repetitive behavior whereby they would chew sort of their hind end, their flank. So as soon as they had the opportunity to, and maybe when set off by a trigger, they would basically lick and chew at themselves, especially the flank, so the back end, until it would bleed. So those are your kind of rough 5 categories. And then I guess we should probably define a little bit what an abnormal repetitive behavior is. And here we have a couple of different subclassifications. So I mentioned earlier stereotypical behaviors. And then, like I say, we have these more compulsive behaviors, and potentially they're slightly different. However, they all have in common that we have these invariant, so always the same, not varying, invariant motor behaviors that potentially don't have a function, although that is controversial. There, we do think that there might be a function to the behavior. But certainly in the more compulsive behaviors, they seem to be uncoupled from triggers in the environment. So you don't need a trigger in the environment to set it off. The behavior has actually just become quite ritualized. I guess that's another way for describing it. So these ritualized behaviors and almost behaviors that occur to the exclusion of all others. So the dog is so preoccupied with performing these behaviors that sometimes they forget to do the normal things that they're supposed to do, like sleep or eat or explore, play, all those types of things. And that can be a negative welfare concern for sure. And we do think about these behaviors as being the one category or one of a few categories that are truly pathological, that are true sort of, I guess, psychiatric conditions, and that really need the support of a veterinary team and a veterinary behaviorist to help work those up and help with the treatment of those. So that's a little bit the description of that. Now, there are certain breed predispositions that are particularly prone to some of these behaviors. And there is research to show that there might be some genetic mutations, or that there are some genetic mutations in certain breeds that actually cause these behaviors to occur. And the classic study there is a study that was done by Dodman looking at flank sucking. Looking at compulsive behaviors in general, but flank sucking and blanket sucking in Dobermans was one of the main behaviors that was looked at. And they found a mutation in the chromosome 7, so the cadherin, the CDH2 kind of locus on the chromosome 7 that seemed to be mutated and abnormally represented. So we do think that there is a genetic component there for sure. It hasn't been widely explored, but it's definitely something that we think about. So if I think about predispositions, then for sure the flank sucking is in Dobermans, flank and blanket sucking is in Dobermans. We have tail chasing, in particular in bull terriers. We have spinning in German shepherds. We have what we call hind end checking in schnauzers. So those dogs would frequently look at their back end, look at their hind end, and sort of check their hind end. Then we have fly snapping in Cavalier King Charles Spaniel terriers. And we have shadow chasing, light chasing in border collies, which is not a big surprise. So we've got quite a few breed predispositions. And definitely if you're presented with a case like that and they do fall into that breed category, that I guess changes our approach a little bit. And changes how we're going to look at those cases. All right, so how do we work these cases up? And it's not too dissimilar to how we approach any other behavior case. And I want to stress that a lot of these presentations absolutely can have physical medical differential diagnoses once again. So we are really, really looking at ruling out any other physical disease that might be contributing here. And so let's say, for example, for acrylic dermatitis, there's a paper by Denerol in 2007 that looked at 6 individual dogs with acrylic dermatitis and found a different physical medical cause for each of those 6 patients. And that went from things like having a pin, an orthopedic pin in that area. So the dog was over grooming or licking that particular area because perhaps there was pain, discomfort due to an orthopedic pin being in there. But we also have things like lymphoma, so we can have cancerous lesions, mast cell tumors. We can have deep pyoderma. We can also have some infectious diseases like leishmaniosis and sporotrichosis, which is a fungal disease. So we really, 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 really need to be looking for physical disease here. Similarly, in the Cavaliers, there are 2 really great papers looking at this fly snapping in Cavaliers. One is by Diane Frank from 2012, who looked at, I think, 7 Cavalier King Charles Spaniels and found gastrointestinal disease in, I think, all of them. So that fly snapping behavior or that kind of licking lips, gulping, fly snapping as a result of gastrointestinal disease. And then another study in 2015 looking at these dogs and looking at neurological comorbidities. So they found Chiari malformation and syringomyelia in quite a lot of them. I think 2 of the cavies were deaf, bilaterally deaf. So looking at neurological presentations as well. So it's really important that, like with any other case, that we really look at the physical medical. If you think about the schnauzers that are hind end checking, could there be pain around the lumbosacral area? Could we have anal gland disease? Could we have hyperesthesia or neuropathic pain there? Do we have dermatological disease? It can be as simple as, in inverted commas, a flea allergic dermatitis where, or fleas where dogs are sort of looking at their back end to see if there's, to kind of deal with the parasites that are there. So there are so many physical medical presentations that we need to be looking for. And of course, the classic ones are pain, dermatological disease, gastrointestinal disease, neurological disease. All of those are really big here, and we need to look at all of those. We also actually have in some of the kind of staring at walls and some of the more sort of sort of neurological, but where dogs are staring at things, staring at shadows, staring at light. We also need to think about ocular disease. So again, a paper showed that some of the dogs had what we call ocular floaters, so something in the anterior chamber of the eye that was causing them to sort of, perform these behaviors. So physical medical is a massive piece here, and we absolutely need to rule that out before we're able to make a diagnosis of an abnormal repetitive behavior, or in particular a compulsive behavior. So what if we've ruled all of that out? We've ruled out all of the physical medical disease, and now we are left with it's probably an abnormal repetitive behavior due to a psychiatric disease or a mental and emotional ill health disorder. Where do we go from there? And absolutely, again, we look at, or we follow our comprehensive treatment approach, where we look at all the different areas that we need to address. So the first one would be environmental management. And here we're particularly looking at, are there specific triggers that trigger this behavior? Do we have certain things in the environment that are antecedents that start the behavior off? And that can sometimes take a lot of sort of observational skills, both on the part of the pet parent, as well as the veterinary behaviorist, to see if there are any underlying triggers. So we absolutely want to be looking for those. The other thing that we want to be looking for is this behavior somehow being inadvertently reinforced? So is there something in it for the dog? When they perform the behavior, do they get a reinforcement, whether that is from the owners themselves, or perhaps internal reinforcement? Is that something that is filling some kind of a need? And that's where we come back to the coping. Is that helping as a coping strategy for something, for fear, anxiety, stress, panic, conflict in the environment? Are they doing that behavior almost a little bit like a human would perform ritualistic behaviors to help them cope with certain things? So that's a big piece to look at. We need to look at the environment and their daily lives. Is the environment impoverished? Do they have enough enrichment? Do they have enough outlets for normal behavior? Is their physical exercise need being met? Is their mental stimulation exercise being met? Are they able to perform species and breed specific behaviors? So for example, for collies who are herding dogs, do they have opportunities to perform those behaviors, or have they transformed or transposed those behaviors into a different context, and it's now this abnormal repetitive behavior? So all of those things are really important to look at. We also want to look at the relationship between the caregiver and the dog. We want to see if that's something that's perhaps a cause for stress or conflict. Is there punishment? Is there a history of aversive punishment-based training? So that's something that's really important to look at. So all of those things, like a global view. So we always want to look at social, environmental. So what's the physical environment like? What's the social environment like? And what is the physical health like? And do we have any other underlying mental and emotional health disorders, such as an anxiety disorder, that could be precipitating this? So that's very, very important to look at. Now, from a brain health point of view, so that kind of falls under that physical health piece as well, we know that there are certain neurotransmitters that are probably linked to and correlated with compulsive behaviors. The two main neurotransmitters are dopamine and serotonin. We know that dopamine is very much involved in motor activity and motor function, so that's something to look at. And we know that serotonin is likely involved because we have some imaging studies that show that, but also because many of these dogs respond to serotonergic medication. So there is very likely an involvement of the serotonergic system. And we really need to think about addressing neurotransmitter levels and making sure that that's part of our treatment plan when we come to it, as well as a comprehensive sort of environmental and behavior modification plan as well. Okay, so what does a behavior modification plan look like? Well, number one is we want to absolutely make sure that we protect the dog from any further self-injurious behaviors. So let's say they're biting their tails to the point where they're bleeding, becoming infected, becoming necrotic, or that the acrylic dermatitis, so licking at their front paw until that becomes ulcerative and infected. So we want to be thinking about physical barriers and protection to any further injury while we put our other treatment plan in place. And that can sometimes look like, wearing an Elizabethan collar, a cone, or covering the area with a sock if we're talking about acrylic dermatitis. But what we have to be really, really mindful of here is that we don't cause frustration by preventing that behavior. Sometimes that behavior is so strongly motivated that preventing the animal or the dog from doing that can actually be worse. It can increase stress levels even further. So it's striking that balance between ensuring that they don't hurt themselves, but also making sure that we're not tipping over into massive levels of frustration. So that's something to really consider. Of course, we want to identify the triggers, as I said, and we want to remove those triggers. We also want to think about a positive interrupter. So if the dog is performing the behavior, is there something that we can teach that's an interrupter that interrupts the behavior and perhaps redirects the behavior onto something more appropriate? So for example, if it is licking, can we interrupt the licking and can we transfer the licking, let's say, onto a licky mat or onto a Kong, something that is not self-directed, for example? So I think that's something also really important to consider. We want to make sure that we have those predictable human-dog relationships. So we probably want to be thinking a little bit about some positive reinforcement training, maybe some clicker training, to try and give a different outlet and a different stimulation, and maybe readdress the relationship between the dog and the caregiver. Routine, really important, especially if we have global anxiety going with this problem. So we want to address routine. We also want to teach calm behaviors. We want to make sure that the dogs are able to calm and settle on command. So that's something that can be implemented. We want to think about maybe scent work, sniffing work, something that redirects away from the behavior and gives a really positive outlet and is likely very good for brain health. Then we want to think about teaching, so differential reinforcement of an alternative behavior. So teaching an alternative behavior that might be incompatible with the repetitive behavior. So behavior that they can do instead of. And there can be many, many different behaviors that we can teach. And it depends on, what the dog is actually doing and what they're maybe even more motivated to do than the repetitive behavior. So there's lots of behavior modification pieces that can come in here. And this is where, the support of a really great trainer comes in, and where, we have that cooperation and collaboration between the veterinary behaviorist and the trainer to really find the best approach for the dog. So let's talk about medication. Medication is probably one of the mainstays of treating these compulsive or repetitive behaviors. And as I mentioned earlier, the response is really, really good to serotonergic medications. So we're talking about your SSRIs, so your selective serotonin reuptake inhibitors, and your tricyclic antidepressants, the TCAs. Fluoxetine is a good choice here, as well as potentially clomipramine. And in the fly snapping study that I mentioned earlier with the Cavalier King Charles Spaniels, where they found underlying neurological disease, actually, so they treated some of the dogs with phenobarbital, which is an anti-epileptic medication, and then they treated some dogs with fluoxetine, which is our SSRI. And the dogs that were treated with fluoxetine had a far, far greater successful response to the dogs that were treated with a phenobarbital. So that is a really big piece, which means that, the likelihood that we have neurotransmitter dysregulation is very, very high. So treating with psychopharmaceutical medications is a big mainstay here. And then depending on what the presentation is, let's say, we do diagnose a hyperesthesia problem, so maybe a pain issue, we might want to add in some other medications there, such as gabapentin or amantadine or memantine. And actually memantine is a drug that there are also some papers on for the treatment of compulsive behaviors. And memantine actually acts on the glutamate system, so it's an NMDA receptor blocker, and it's mopping up all that excess glutamate, which is our main excitatory neurotransmitter. So treatment with memantine, and we've also got a paper where memantine and fluoxetine were combined together and had synergistic results, and we have another paper where we had memantine on its own. So that's something else to think about. There have also been some papers using opioid antagonists, which has worked well. However, the downside with the opioid antagonists is they usually need to be given by injection, and they only last for a very, very short period of time. So practically, they're not really appropriate to be used. So that's something to consider as well. And then we might look at other presenting signs that are occurring simultaneously and treat those concurrently. So very important to have that really comprehensive plan, but medication is usually a part of that. And in my experience, certainly, and also from chatting with other veterinary behaviorists, oftentimes we need to use a slightly higher dose of our SSRIs and TCAs in compulsive disorders. So for example, with fluoxetine, where you might normally use, let's say, 1 to 2 milligrams per kilogram for a dog, with a compulsive behavior, you might need to go slightly higher, so maybe 2 to 3 milligrams per kilogram. And similarly with clomipramine as well. So sometimes we need higher doses for these presentations. And then there's one other thing I want to talk about, and that is the idea that sometimes a repetitive behavior can start off as a medical presentation. So let's say we do have some chronic pain, or we have some hyperesthesia pain, and the dog starts to perform the behavior and finds that reinforcing, so it somehow soothes the behavior, or it makes the dog feel better. And we then go in and treat that physical underlying cause, and we actually get on top of it. We might even cure it. It's possible that the dog continues to perform the repetitive behavior because of that learning, that classical conditioning that's occurred, which has allowed the dog to feel better. So sometimes it can be complex, right? We can have an abnormal repetitive behavior that might have an underlying physical cause. We treat the physical cause, but the behavior remains. And so we often need to come in and do both. So we need to treat the physical as well as the mental and emotional. And that's something that we're finding in so many presentations, is that yes, we might have physical underlying disease, but we might concurrently have mental and emotional. Whether they're directly related, they usually are. But let's say we have, a dog that's not doing an abnormal repetitive behavior, but that has chronic musculoskeletal pain, and at the same time is anxious because of the pain. We need to treat both. Yes, we treat the pain, but that doesn't necessarily mean that the anxiety goes away. So we need to treat both of those. And that brings me, I guess, to the final point of sort of looking at and treating these abnormal repetitive behaviors, is that we really need to address global stress levels, global anxiety levels that might be comorbid, that might be a result of, or that might be a cause of the abnormal repetitive behaviors. So we really need to ensure that we're covering our basis in terms of addressing fear, anxiety, and frustration for sure. And a lot of times the medications that we use will cover both of those aspects, but we need to stay mindful that we're hitting all the targets and that we're treating all the components of that that behavior. So I think that's it. I think that's a whistle-stop tour through abnormal repetitive behaviors in dogs. Obviously, one could delve so much deeper into the research and the individual presentations. You could spend half an hour talking just, or maybe even longer, talking just about flank sucking in Dobermans, or that fly catching in Cavalier King Charles Spaniels, which is such a very fascinating presentation because of all the different components that could go into that. And we will absolutely delve deeper into some of these individual presentations. But I just wanted to give you a bit of an overview because we did kind of abnormal repetitive behaviors in cats a couple of episodes ago. So we looked at psychogenic alopecia and pica, and dogs also can, by the way, have pica. So that's the ingestion of non-food items. So that kind of fits in that oral bracket. So there's quite a lot there still to dive into, but that was an overview of an abnormal repetitive behavior. And if you're a vet listening to this and you have perhaps a patient with this, I hope this gives you a little bit of a stepping stone to kind of jump off from and think a little bit further about. And if you're a pet caregiver or pet parent and you think that your dog or cat might have abnormal repetitive behavior, I hope that's given you a little bit of an insight into the complexity of it and how important it is that you seek out professional help to look at this, because these presentations are probably not the easiest to treat, and it might take a little bit of time to sort of understand what's going on. There might be a lot of environmental changes that need to happen, a lot of sort of social changes that need to happen, and then we need to do the physical workup, and then we need to come in and treat comprehensively. So I hope that's given you a bit of an overview and a good idea on abnormal repetitive behaviors in dogs. And like I say, we're going to delve a lot deeper into that going forwards. But yeah, for now, that is everything from me. I'm going to be dropping some of the papers I mentioned in the show notes. There are so many papers, so I'm just going to cherry pick some of the ones that I think are really relevant. But like I say, we have so much research on this particular topic. I'm going to just maybe give you two, three, four of the highlights that I think are important. And yeah, let me know if you want any other papers. You can message me directly, and I'll be very happy to share anything else with you. If you've got a case that you're struggling with, absolutely reach out, and we can either do a vet-to-vet consult if you're a vet, or we can do a one-on-one consultation if you're a pet owner, and I can definitely help you out with those research papers and let you know what the evidence base is that we have, and where we can go with that. All right, everyone, that is it for this week. I hope you enjoyed the episode, and I'm going to see you next week for episode 50. Bye for now.